All right. So we're going to do this video. It's a teaching video that ends up on YouTube, and you don't have any problem with it ending up on YouTube? You want your face blurred or not?
Because he can blur you out. If
I can blur you out.
Yeah, blur me out.
Okay, we'll do that. So, do you want to tell the story of what happened to you?
I had a couple of drinks and fell asleep watching TV, sitting up on the sofa. Don't really remember where my hand was when I fell asleep. And when I woke up, it was
Doing that.
And I didn't notice it really until I went on the computer and was trying to use the computer.
When were you on the computer?
When I woke up.
Okay, in the middle of the night.
Well, no, it was whatever time I woke up.
Early morning hours?
It might have been midnight.
Okay, but you went to use the computer, and what did you find?
That it was, my hand was not working.
Okay.
And then I did my little test, you know, they say smile. Somebody had just sent me that email too. I did the smile, I stuck out my tongue, and I thought, this is going to go away in the morning, so I just went to bed.
Yeah, so you were making sure you didn't have a stroke.
Right.
All right.
And there was nothing else. Not my foot, nothing.
Yeah.
Not the other hand.
Very good.
Nothing.
A very intelligent patient here.
Yeah,
All right. Okay, so Joe, you're gonna do the exam. You're gonna demonstrate. So what's your working diagnosis?
So what we're thinking we have here is a radial nerve palsy and possible compression at the spiral groove at the humerus.
All right.
And I think on physical exam we'll be able to show that that's what it is.
Okay.
So first, I'm just going to have you do some basic movements with your arm. Can you raise your arms like this? So you'll see, her axillary nerve, everything's intact. Can you take your arm and now flex it? Okay, can you extend it? Okay, hold your arm out for me and take your hand and just pronate it like that. So her pronation is intact.
Okay.
And then can you supinate it for me? Okay, and her supination is intact, but does it feel a little different when you supinate? Like, do you have any?
I'm feeling this muscle.
Okay. What we're going to try now is we're going to test for brachioradialis weakness.
Okay.
The radial nerve innervates the brachioradialis muscle. Can you hold your arm like this and then press up against my hand? So we did this test earlier, and it seems that she actually doesn't have much weakness in her brachioradialis.
Okay.
Now, as you'll see when I hold her hand up like this, she actually has wrist drop. And
Okay. Now try and we'll put both hands up together. Bring the other one over there for the camera, and now raise both wrists up. Flex both. Yeah, dorsal. Okay. Yeah. So you're unable to do that with this hand here.
Yes, can't do it with the right hand.
Now, what about extending the fingers? Can you extend those fingers at all? Okay. All right. Very good.
You can actually now make a fist. She's able to make a fist now.
Hey, compare her grip strength though. Go ahead and put both fingers now and compare that.
Squeeze as hard as you can. Grip strength is significantly decreased in the right
hand. It is. That's what I found on my exam. Now, have her do abduction of her thumb.
Okay, can you take your thumb? It's like that now. Can you move it like this? What about with the other hand?
Yeah.
So
okay, so let's put both hands together. Now let's try and abduct that thumb. That's as much as you can do.
Yep.
Okay. Now what about sensory loss? You want to go over that, Joe?
Now you had told me earlier that you have some abnormal sensation in the dorsum of your hand, arm right here, and then in the dorsum of your hand. But we're going in, but you have normal sensation.
Pretty much, yeah.
Here on the palm. Okay.
I want her to flex her elbow, flex it. Now I want you to have her push you away with that. And what's your assessment of strength?
Let me compare. A little bit stronger on the left side.
But her triceps are definitely intact.
Yeah, definitely intact.
Yeah.
So no diminished tricep strength.
So what nerve is it then that on the wrist? Go ahead and put your hand back down. What innervates this area right here? Hi, Dr. Penny. How are you?
Fine, thank you. So this is radial nerve.
So that's going to be your superficial radial nerve branch that is, and people with handcuffs will sometimes get damage to that, and they'll just have numbness. So it's a sensory nerve that comes out there. But you said her numbness actually goes from here all the way up. Is that right?
It's a neuropraxic injury, which means that the nerve it's intact. It's just that it's been damaged from the pressure, and it'll heal. And it'll heal by something called axoplasmic flow, where protein will pass down, and that when it does heal, sensory will probably come back before motor. So you start to feel tingling, burning. Some folks find it unpleasant, dysesthesias, but that will pass.
Okay.
And then, of course, the motor. And then, of course, you've got to try to work with it, and therapy is going to be important.
Okay.
But we're talking months as opposed to.
Do you think it could be 6 months?
Yeah, 3 to 6, I would think.
Okay.
Yeah, depending on the degree of neuropraxic injury.
Anything else?
Good news, it'll come back, but it's going to take some time.
Okay.
Dr. Penny's a neurosurgeon.
That's
Who-
what the nurse said earlier.
Yeah.
She
So he
said,
also,
I really
but
lucked out today.
he's also an emergency medicine doc. So
And we're blessed that we can capture all this because this is a nice teaching tool.
Yeah.
So.
all right, so that goes around the thumb.
Okay, and then this one. Well, don't let me get it too tight.
So you were saying you were trying to pay bills and use your left hand to operate the mouse, and that's when you kind of, and you were actually trying to pay bills because you were thinking
I
that
wasn't. I didn't know what
if
was
this
gonna
was a
happen.
stroke or something like that, you need to have those bills paid.